Welcome to Ulosca channel. Access all nursing practice questions. ATI Nursing final practice questions with answers.
Question 1. Which action best demonstrates the use of therapeutic communication? A. Why didn't you take your medication? B. You should exercise more often. C. Tell me more about how you're feeling. D. Everything will be fine, don't worry. Which one is the correct answer? The correct answer is C. Tell me more about how you're feeling. Explanation. Therapeutic communication encourages clients to express their thoughts and feelings. Asking open-ended, non-judgmental questions helps build trust and promotes deeper sharing, while advice or reassurance may shut down communication. Question 2. Which statement about documentation is true? A. It can include personal opinions. B. It must be completed once per shift only. C. It should be factual and objective. D. It may be delayed until the end of the shift. Which one is the correct answer? The correct answer is C. It should be factual and objective. Explanation. Accurate documentation should be objective, timely, and free of personal opinion. It reflects the client's condition and care provided, forming a legal and clinical record. Question 3. A nurse is teaching a client how to use a walker. Which instruction is correct? A. Move the walker and the affected leg forward together. B. Keep your arms straight while using the walker. C. Move both legs ahead of the walker. D. Hold the walker close to your chest while walking. Which one is the correct answer? The correct answer is A. Move the walker and the affected leg forward together. Explanation. Safe walker use involves moving the walker and the affected leg at the same time to maintain balance and support. Arms should be slightly bent and the walker kept in front, not too close to the body. Question 4. Which of the following is an example of a nursing diagnosis? A. Pneumonia. B. Risk for falls. C. Appendicitis. D. Fractured femur. Which one is the correct answer? The correct answer is B. Risk for falls. Explanation. Nursing diagnoses identify actual or potential health problems that nurses can address independently, such as risk for falls. Medical diagnoses like pneumonia are conditions diagnosed and treated by providers. Question 5. What is the primary purpose of a nursing process? A. To provide a legal basis for care. B. To improve communication between providers. C. To deliver individualized, client-centered care. D. To reduce hospital costs. Which one is the correct answer? The correct answer is C. To deliver individualized, client-centered care. Explanation. The nursing process is a framework used to assess, diagnose, plan, implement, and evaluate care tailored to each client's unique needs, ensuring person-centered and effective care delivery. Question 6. Which action should the nurse take first when a fire breaks out in a client's room? A. Call the fire department. B. Activate the fire alarm. C. Remove the client from the area. D. Close the doors and windows. Which one is the correct answer? The correct answer is C. Remove the client from the area. Explanation. According to the RACE acronym, the nurse's priority is to rescue anyone in immediate danger, such as removing the client from the fire-affected area. Question 7. Which finding requires immediate nursing intervention? A. Urine output of 50 milliliters HR. B. BP of 138.88 millimeters of mercury. C. Respiratory rate of 8 breaths min. D. Heart rate of 82 BPM. Which one is the correct answer? The correct answer is C. Respiratory rate of 8 breaths min. Explanation. A respiratory rate below 12 breaths min indicates hypoventilation, which can compromise oxygenation and requires prompt assessment and intervention. Other values listed are within or near normal limits. Question 8. What is the first step in the nursing process? A. Diagnosis. B. Evaluation. C. Implementation. D. Assessment. Which one is the correct answer? The correct answer is D. Assessment. Explanation. Assessment is the foundational first step of the nursing process. It involves collecting subjective and objective data to understand the client's health status and determine further steps in care planning. Question 9. Which PPE should a nurse wear when caring for a client on contact precautions for C. difficile? A. Gloves only. B. Gown and gloves. C. Surgical mask and gloves. D. N95 respirator. Which one is the correct answer? The correct answer is B. Gown and gloves. Explanation. Contact precautions for C. difficile include wearing gown and gloves to prevent the spread of infection via direct or indirect contact. Alcohol-based hand sanitizers are ineffective. Hand washing is essential. Question 10. A nurse delegates a task to a CNA. What is the nurse's responsibility? A. Nothing after delegating the task. B. Ensure the CNA completes the task correctly. C. Perform the task independently. D. Ask the provider for permission. Which one is the correct answer? The correct answer is B. Ensure the CNA completes the task correctly. Explanation. The nurse is responsible for supervising and ensuring delegated tasks are performed correctly and safely. Delegation includes right task, person, circumstance, direction, and supervision.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.